the overall cost of care for those patients down. And that's very consistent with what I've been talking about tonight. And to their credit, the family practice groups have been out front on urging Congress to consider these kinds of changes every time these Medicare payment issues come up. My hope is that as the pressure mounts for getting away from this current unsustainable, vicious circle system where you lower the payment rates and then you get more volume and then you lower the payment rates again, and the whole time quality is going down, not up. As the pressure goes up there, and as there's more evidence that these kinds of medical home payment systems can really work, that we'll actually be able to get it implemented. And this will be a legislative issue this year. So it's very hard for an individual physician to make a difference, I know, in these overall policy issues. But the family practice groups have been coming together, and I think are getting pretty strong support now from their membership for exactly the kinds of payment reforms that I've been talking about tonight.
I just, this is sort of a follow-up on the previous question. I like what you say about pay for performance, and I'm here at Dartmouth, right? So I agree with the model, paying for higher value care and effective care and not just per volume. But when I hear the discussions of pay for performance, if you just sort of closed your eyes and thought you were 15 years before, you just insert managed care there. Mm-hmm. And we have very similar discussions. You go back and read the literature, right? We talk about it in the same way. This was going to be, managed competition, and so you would have the providers sort of competing about value and quality rather than about cost or volume. You talked about capitation as just a similar kind of thing. And what I'd like to maybe hear your comments on, might we do a better job now thinking about the potential problems we might see in pay for performance that we didn't see coming, or maybe some people did, with managed care? Because when managed care was done right, it did all of these things. There was high quality care, better delivery, bringing in patients.
Yeah, there's some managed care plans that are doing a demonstrably good job of this today.
Still doing this today, and yet others, of course, started to compete more on cost and excluding people who were high-risk patients and all of that. I mean, do we have risk of that in pay for performance, and what might be the things that we watch for as we try to implement pay for performance?
Absolutely. It's a really good question, and I guess a couple of points, but there are probably many, and this is exactly what we should be doing as we implement any kind of health policy reforms, particularly these that can have potentially such a big effect on the healthcare system. Remember, managed care reforms 50 years ago, or 15 years ago, weren't really about managing care as much as they were about managing costs. And there's a lot of discussion about managed competition, but back then there were hardly any good measures or good awareness of the public